Today I will talk about the clinical skills as a part of my clinical practice lecture series in my YouTube TV channel, and that's why I will today try to be and talk more generally about the importance of clinical skills and the importance of teaching the clinical skills in the medical curriculum of any medical school anywhere in the world. Actually, teaching the clinical skills is as important as teaching the medical knowledge or the medical sciences, the basic medical sciences and the clinical medical sciences. But teaching clinical skills is another topic or a different topic, as I mentioned. That's why I am stressing on the issue of implementing teaching clinical skills in the medical schools, starting from the first year, and in every year of the medical college or the medical university, the medical student has to learn something new about the clinical skills. Because, as I mentioned before, the range of clinical skills is very wide, and it covers many topics in the medical clinical practice. That's why it needs time, and it should not be only limited to the final years of medical education in the medical school, but it should start from the first year of the medical school. The medical student has to learn something new every year about the clinical skills in an escalating manner, because they are as important as the medical sciences, as I mentioned, basic and clinical medical sciences, which are already involved and implemented in the curriculum of any medical school in the world. So to continue today, as I mentioned before, that the clinical skills include the history-taking skills, and it includes also the physical examination skills, and it includes the selection and interpretation of the clinical investigations which are done for the case, and this is number 3 step in the medical evaluation to take a clinical decision regarding the diagnosis of the case. History taking, get the symptoms, and then physical examination or the bedside examination to look for any physical signs, and then the clinical investigations which are needed to complement the clinical perspective about the case. And I already talked about it. The selection of clinical investigations is a skill, and the interpretation of the results of the clinical investigations in a logical way and in a critical thinking manner is another skill. Selection skill, interpretation of medical investigations or clinical investigations is a skill. And then after that, also I talked about the skills, other skills which are needed in addition to these 3 important skills in the interview, examination, and then requesting clinical or medical investigations, whether It is laboratory or pathologic or endoscopic or radiologic investigations or immunologic or whatever investigations needed according or required according to the case, which is different from case to case, as I mentioned before. And then after that, the communication skills also should be discussed. And in the communication skills, the communication between the patient and the physician, and between the different physicians involved, if there is what we call multidisciplinary approach to the case for the ultimate management of the clinical problem. And this is the basis of what we call the teamwork and the teamwork skills in clinical diagnosis and in clinical decision making. This is the communication. This is generally, but I will also talk about communication skills in more deeply and in details in a separate episode in my YouTube TV channel. And then we have the other specific clinical skills which are important also in clinical practice, like the skills needed for the doctors working in the ER and in contact with acute cases, and this is the acute medicine or emergency department clinical skills. And then we have also clinical skills which are needed for patients in the ICU and the critical care units, different from the skills needed in the emergency department or in the ER. And then we have the clinical skills which are needed for the management of end of life and terminal cases, and this is also very important. What are the skills needed for the management of end of life situations and the terminal patients and the dying patients? This is also very important. And then the last thing, also the skills of management of the dead patient, what to do with the family and the relatives of a dead patient. This is also involved in or needs special skills. And then we have also the skills which are needed for the cardiopulmonary resuscitation, and this we can include it with and discuss it, or we can discuss it together with the skills needed in the emergency department or in the ER, but it can be discussed separately, because the cases which need the cardiopulmonary resuscitation or the code blue cases might be encountered anywhere in the hospital, or maybe even outside the hospital in the street, or maybe even in a private doctor clinic, for example. So it can be anywhere. It's not necessarily to be encountered in the emergency department, a patient who needs cardiopulmonary resuscitation or life support. So I will discuss the cardiopulmonary resuscitation and basic life support clinical skills in a different, as a separate entity, separate from the clinical skills needed in the accident and emergency rooms. And then we have the skills related to what we call intravenous fluid resuscitation, which is a common issue in clinical practice and in patient management, whether in hospital or in a private clinic, or even at home for bedridden or crippled patients who don't move, like patients in coma or coma-like states, like the locked-in syndrome patients, for example, at home. So the intravenous fluid resuscitation or intravenous fluid therapy also needs special skills, and I will discuss them in a separate episode. Intravenous fluid management skills. especially in patients, as I mentioned, to keep what we call the fluid and electrolyte balance of the patients, which is also very important. And then we have the clinical skills related to what we call nutrition and hydration, and this includes the issues of enteral nutrition and parenteral or intravenous nutrition, and the consideration of intragastric tubes and other methods for delivery of gastric or enteral nutrition, and then the parenteral nutrition. And this also is a separate issue which needs special clinical skills. What are the skills needed for doctors performing the or managing nutrition of support of the patient? And then we have the skills related to the operating rooms, and this is not my field, but this is the scope of surgeons, and this also needs special skills. I will not talk about this because I'm not a surgeon. And then we have the clinical skills related to patient safety and patient care, which are very important, and I will discuss it in a separate episode. And then we have the clinical skills needed in drug prescribing, and this is very important for all practicing physicians, how to write a prescription in a professional and skillful way. So drug prescription or drug prescribing also, of course, needs special clinical skills, and I will focus on this issue and discuss it, and discuss the issue of drug interactions and the benefits of developing or learning and improving the skills of the physicians who are involved in drug prescribing. Also, the what we call the patient rehabilitation or rehabilitation settings clinical skills, like taking care of elderly and elderly people who are living alone, and those people also, whether elderly or not elderly, who are having special mental or psychological or psychiatric problems, and they need special rehabilitation. So this also has its clinical skills. All these are different topics which are considered to be what we call specific clinical skills, which are dealt with in specific clinical situations, which I mentioned as I mentioned them. Each one has a different heading, and we should discuss the skills related to this topic or this heading. This is in general the my coverage of the clinical skills needed by physicians, and I focus on physicians, not surgeons. Physicians working in contact with patients in clinical practice, and they are important for their proper clinical performance أو الأداء الإكلينيكي بتاعهم في in hospitals or in clinics as indicated. Thank you so much, and tomorrow I will talk about the start to talk about the history taking clinical skills and physical examination clinical skills. Thank you so much, and I hope that my colleagues and my healthcare fans make benefit of these lectures, at least to remind them of basic issues which help them to improve their clinical performance. as health carers working in the healthcare professions, and especially that these issues might be important also from the bioethical point of view or from the medico-legal point of view. Thank you so much, and tomorrow we meet again in another talk.